Good afternoon. On behalf of the Lupus Foundation in Minnesota, I want to thank everyone for joining us today for the webinar called Interconnections, Stress, Pain, and Health. My name is Sandy Parnell, and I'm the Director of Education at the Lupus Foundation in Minnesota. Very pleased to introduce our presenter, Brenda Frie. Brenda joined the Occupational Science, Occupational Therapy Department at St. Catherine University in 2007 after 24 years of clinical practice as an occupational therapist. She's an assistant professor in the Master of Arts Occupational Therapies program, responsible for teaching clinical kinesiology, biomechanical concepts, research, and master's project courses. Her clinical background includes experience with adult rehabilitation, hand therapy, clinic administration, and supervision. Her research interest is community-based educational programming for individuals living with chronic disease. Brenda is currently involved in research to determine the effectiveness of fatigue management and physical activity programming for those living with lupus. Before Brenda begins, I just want to mention a couple things about the functionality of the webinar system. Your webcam function should be turned off. Turn on the mute function. The only voices you will hear during the webinar are Brenda and my own. And your audio will be heard through your tablet or computer. Please think about questions and jot them down. Type in the question in the sidebar. I will see it, no one else, and I'll ask Brenda during the presentation or at the end of the presentation. Also, we're recording today's sessions for future audiences. The podcast will be archived on our website probably tomorrow. And at the conclusion of the webinar, a survey will arrive in your email, and we hope you take a few minutes to complete the survey because your feedback really does help shape our future webinar programming. If you want a certificate of attendance for today's presentation, please email me at sparnell@lupusmn.org. And without any further delay, welcome, Brenda. We look forward to your presentation.
Thank you, Sandy. This presentation is an introductory presentation that's going to speak about a couple very complex processes: stress, pain, and their impact on health. Next. As Sandy mentioned, my heart is both in the clinical practice and in academic worlds. In my work, I work for St. Catherine University and Fairview Hand Center as an occupational therapist. I also like nature. I love to hike and camp. So for this presentation, I'm using a lot of my own nature photos. Like plants and animals in nature, our bodies are amazing. Pain and stress responses are natural protective responses that have helped us survive on this earth. The natural photos throughout this presentation are meant to remind us that of our connections with the natural world and bring a sense of peace and calm to topics that are at times threatening. My clinical experience in treating those with lupus helped lead me to the belief that education can be a clinical intervention. Understanding our body's response to stress and pain can reduce fear and help us navigate the challenges of life. Most of the research evidence for education as an intervention for reduction of stress and pain was taken from related research on the management of low back pain and conditions such as fibromyalgia, not specifically those with lupus. The objectives of this presentation are to learn the basic physiology process of stress and pain, to understand the connections between stress, pain, and health, and to understand the influence of stress and pain on the immune system. Research shows that the majority of those living with SLE appear to cope adaptively to pain. They try to maintain activities and are open to social support. I found this true in a needs assessment survey that I did in 2010 of 96 Lupus Foundation members. The members expressed interest in attending self-management programming. 58% expressed interest in pain management programming, 56% in stress management programming, and 52% in coping skills and life balance. So why is education on stress important? The American Institute of Stress cites 43% of all adults suffer from adverse effects due to stress, and 80% of all visits to primary care physicians are for stress-related disorders. Stress has been linked to the development of diseases such as heart disease, cancer, lung disease, accidents, and autoimmune disease. Over the past 100 years, the leading causes of death have changed from influenza to lifestyle diseases. Today, we realize there's a link between our nervous system input and the immune system and brain function. Although the direct relationship is still theoretical, most accept that there is a relationship between the mind, the body, and the spirit that influences health. Emotional stress can alter the immune system. As Daniel Wallace, author of the Lupus book, states, our head bone is connected to our T cells. Chronic stress can cause increased cortisol and glucocorticoids, which has been linked to altered function of our T cells, our immune system. So why is education on pain important? Similarly, the Institute of Medicine Chronic Pain Report reports that chronic pain affects over 100 million people per year. The prevalence is more than heart disease, cancer, and diabetes combined. Chronic pain significantly disrupts occupational performance and life skills. On the contrary, it has been found that engaging in occupation has a potential to mediate pain and to alter biological, physiological, and social factors that are known to influence the pain experience. This is the basis of self-management programs that often are used to complement biomedical approaches. So when we look at stress found with lupus, what research shows is that most of the stress related to lupus is in regard to daily stress, not what we typically think of as life stressful events such as death or divorce, but daily stress. This daily stress was associated with increased clinical symptoms of joint pain, skin rashes, fatigue, influences on cognitive skills such as memory, fluency, and attention. Other studies have found social stress is correlated with fatigue and reduced physical activity. Emotional stress has been shown to increase neuroendocrine hormones, which regulate immune function and can be related to altered immune system. In the survey I did of the needs of Lupus Foundation members, greater than 30% of members reported moderate to high level challenge coping with stressors such as depression, anxiety, and finding a support network. Pain is also common in lupus. Over 50% of Lupus Foundation members report significant moderate to high levels of pain, specifically joint pain. Other types of pain symptoms commonly reported are muscle pain, 72%, headaches, nearly 60%, Raynaud's phenomenon, which is a vasoconstriction response of the hand, 40%, oral and nasal ulcers, 35%, abdominal pain, 30%, fibromyalgia, 20%, and esophageal pain, about 20%. So pain is often a secondary symptom associated with lupus disease process. The term stress, as we use it today, is a relatively new term that has become popular over the past 30 years. The term originated as a term in physics to describe force that is placed on objects with enough tension to bend or break an object. It is now a common term used to describe stressors at home, the workplace, or more recently, the technostress related to the use of technology in our society. The term stress is used to describe the level of tension that people feel is placed on their minds and souls by the demands of their jobs, relationships, and responsibilities in their personal life. It can be used to describe a state of anxiety produced when events and responsibilities exceed one's coping strategies, or the lack of inner peace. There is no medication available necessarily designed to decrease stress. Rather, it is preventable or correctable by altering habits, behaviors, and expectations. Lifestyle balance is an evolving concept relating to the management of life stressors. The imbalance between the demands of current life and people's ability to cope can result in stress. Imbalance in work-life responsibilities can impact the quality of family life, which can increase stress. The realization of the need for life balance is reflected in the media with many books, articles, talk shows, and community education courses designed to reduce stress. While this concept may appear new, it actually has roots in many cultures that have promoted life balance: Native American culture, Chinese culture, religious cultures that promote days of rest. An important part of the definition of stress is that it can result from real danger or perceived threat. An example of this is as I walked into a dissertation meeting with my advisor yesterday. On the way to his office, I noticed my heart start pounding. I quickly realized my professor is not going to hurt me. I'm fine. I was able to take a deep breath and calm my system down. So there's a direct connection between our thought processes and our body's response. It is not possible to have pain and not know about it. It is a conscious protective decision by our brains. Pain is seen not as necessarily as a sign of damage, but more an individual response to threat of actual or potential tissue damage. Another way to look at it is that pain is produced by the brain after our nervous system, which is very individual from person to person, has been activated and concluded that the body is in danger and action is required. Our brain can turn on or turn off a pain response. It is better than any pain medication. If you close your eyes now and think of yourself with a broken ankle, limping across the street, you glance to your left and you see a bus driving towards you out of control. What do? You run. Does your ankle hurt? No. The brain has the ability to, in that second, to turn off that pain response. We've heard of this, right? You hear of people that are very injured and are able to calm their pain enough to function, to get help and survive. Everybody's pain signal is also different. You probably notice people with different pain tolerances. I think of my son. I have one son, my oldest, that's an adrenaline seeker. I mean, he races, bangs himself out every weekend, and to him it's fun. I wouldn't imagine doing half the things that he does. You may see this like rodeo cowboys and demolition drivers. You know, they have different pain signatures. So it's an individual response. There is a connection between stress, pain, and health. Pain and stress are gifts. They are designed to protect us from injury. Without ability to detect stress, we would overuse our body and hurt it. It's an important protective response. In both pain and stress, our brain relies on input from our sensory receptors to determine the appropriate response. The brain interprets the input and decides if there's a perception of danger. Both stress and pain responses can be as short duration to protect us immediately, or that's what's called an acute stress or pain response, or chronic when the pain or stress persists even though that igniting incident is no longer present. Stress and pain can influence our function. The brain thought process uncodes the stress and pain receptor information, which helps us determine which experiences are safe and which experiences are dangerous. This information helps us interpret our daily life and guide our body's responses appropriately. Our brain, in turn, creates a history of responses. This is why when I hurt my knee on the ski hill, downhill skiing, just the thought of going skiing again made my heart pound. My brain had stored that memory, and now I was fearful of having that repeat again through the history memory. Now you notice I tackled two big topics in this presentation, stress and pain. That's because there is a relationship between stress and pain. Being in stress has been shown to increase our pain level. Being in pain has been shown to correlate with increasing fear, which increases our stress. The responses of stress and pain are interconnected. You can see on the pain-producing fear diagram on the left that in this diagram, the threat circle indicates there's a sensation of pain. The brain interprets it as threatening or fearful. This could be input from different information sources that are valid but may give us cause for fear. So if a friend after a knee replacement tells you it's going to be very painful, and the doctor tells you how bad your knee is and how much therapy is going to hurt, you're going to be fearful. And that fear increases the stress response and may make it so that you're afraid to move. So they're interconnected. Now the second circle shows a model of increased understanding. So in this situation, you still have pain. You still have the knee replacement, which yes, does create pain. But in this scenario, you are educated on why the pain is there and about how long it is and how you really need to move to normalize the pain response. And that movement is going to help you get your motion back and reduce the swelling, as long as it's done carefully and not too aggressively. So you gain knowledge about that injury, and it reduces your fear and creates understanding so you can work with that injury so your body is healed. So this model demonstrates the value of really understanding the processes of stress and pain in a therapeutic context. So this slide demonstrates the thoughts that might be behind these two models. In the first scenario is the thought process that you go through when you know that something's going to happen. I hurt because of this. Movement will damage me. Pain means something is wrong. And these are all valid things. But those fears can increase stress. Increased stress is directly related to increased pain. The opposite is, if your mind really understands what's happening in your brain and understands these responses, it can help you resolve the fear that are surrounding around them. So instead of thinking, I hurt because my knee joint is the worst one that anyone's ever seen, you can go, okay, I hurt, this is going to hurt, but because of this I'm going to be better. And that's the theory behind the neuroscience education, showing that education can actually help us cognitively understand the processes and actually reduce our pain responses. So research in neuroanatomy has shown that education alone reduces pain levels and improves movements in those suffering from back pain, fibromyalgia, and whiplash. This is an example of how our brain responds to inputs that we have. And we'll be talking a little bit more about this. But basically, your distal receptors through ion channels detect sensations, temperature, stress, movement, immunity, blood flow. They detect this. That input goes into your spinal cord and then back up to your brain. And your brain is thinking, how dangerous is this? Is this really dangerous? And if it is, it's going to facilitate a response. So if I touch a hot burner and my input goes to my brain and my brain says, oh yes, that's hot, it's going to send messages, so I immediately withdraw my hand and don't hurt myself. However, you know, say I touch something that's not very sharp. I touch the tabletop and that input goes to my spinal cord and my brain says, how dangerous is this? And we're like, no, it's not very dangerous. So no, I don't really have to respond to that. Now, there's a lot, I'm sure all of you have heard of the placebo effect, which is the effect that can be created by the mind alone in believing that something works. It's a conscious decision by the brain, and that belief influences our function. This is why a lot of studies you'll see now, medical studies, they'll give not only the medication, but a placebo. And many times, maybe 30%, I mean, depending on the study, the placebo will have benefits too, because if people feel like it's the medication, they can have positive effects. The placebo effect is really just showing us that our brain was built with healing capacity, which is totally amazing. Okay. Now I'm going to review the stress processes and the pain responses. This is pretty much just another way of looking at what I just said. So you have an alarm, your sensory receptors send a message to the spinal cord and to the brain. The brain decodes that and decides what to do, what to regulate. This alerts our system. I mean, basically, both stress and pain activate large pieces of our brain, not just one area, some more than others. But this alert system then activates the hormonal system. And the hormonal system then releases the chemicals into our bloodstream that creates the response in our bodies so they know what to do through this kind of lock and key binding mechanism that creates our body response. So our body responds then with the increased blood sugar, increased heart rate, increased oxygen for tissues, and ready for fight or fight. The pain response is also based on our sensory receptors. I should say sensory receptors, not pain receptors. We really don't have pain receptors. We have receptors that give our brain sensations so it can tell if we're in pain. So this can be with regards to internal tissues such as joint receptors, or it can be response to threats in our external environment as well. Then the receptor information travels through our nervous system to the spinal cord. And this has kind of been an interesting area of research that's relatively recent, but the spinal cord creates a fairly large role in deciding if it should send messages up to your brain or not. And the way that it filters at the spinal cord level is hugely genetic. That pattern that your body sends messages, it's a large genetic component, so it's very interesting. And then, as I've mentioned, the brain interprets the threat. So the pain perception is really from the brain. There is current thinking that spinal cord almost can function like a volume control to set the pain higher or lower. As I have mentioned, there's actually studies on using education as an intervention, and education as an intervention alone, particularly for pain. In this model, most of the models use quite extensive education, so much beyond what I'm doing today, but teaching people very extensively about their stress responses and pain responses helps them understand why their heart is racing, why their blood flow is altered, why they're experiencing them, which therefore helps them learn mechanisms to cope with it. Next slide. So some of the benefits that have been shown from education on our neuroanatomy are changes in pain beliefs and attitudes, improved cognitive skill, improved physical performance and function, increased ability to tolerate pain, increased ability to move and participate in exercise, empowerment through understanding these complex processes, and decreased brain activity in response to stimulus. So research shows that one-on-one education will result in significant changes in pain beliefs and attitudes. Okay. Now, most of you have heard about stress responses. I'm going to talk a little bit about the benefit of stress response. The fight or flight response is actually a protective response that helped us survive. It was designed to help us defend and attack, or response to anger and aggression. It's a fight response that allows us to recruit power and strength for short durations. An example of this is when you hear stories of people lifting cars off of somebody injured, so that stress response gives the muscles more strength distally to perform things that we normally wouldn't be able to do. Another protective benefit of this stress response is the response of hiding in response to fear, so we wouldn't be found. This tends to be more common in women. It is called flight or tend and befriend. In women, they're known to have, they figure that both of these can occur both in men and women, so I don't mean to stereotype, but I think it helps understand our responses. They find that women tend to have a little bit more of a nurturing response to protect their offspring. So in response to stress, they may be more prone to hide and shelter their offspring than to fight. Or an example would be kind of brain freeze. You just freeze still. You can't move from there. So stress can be activated by real fears, and this helps protect our bodies. But the same level can be activated just as strongly by perceived threats, such as fear of your grades on a test, or fear a boyfriend doesn't like you anymore. And I specifically remember my first experience with stress, and it was in college, and I was taking a biology test, and this test was with all sorts of medical students, and I knew I needed a good grade in order to get into OT school, so I had a lot of anxiety going into that test. And I looked at the first question, I didn't know the answer, and I immediately brain freeze. And pretty soon I was faint, and pretty soon I was in the nurse's office, and it wasn't a good experience. So that kind of shows how this response can get out of perspective. It wasn't a real fear. It wasn't going to be hurt by that test, but my brain just went on and on and on, not knowing that first answer. After I calmed myself back, I went back and was able to take the test and did just fine. But definitely our thought processes can create these, whether it's real or perceived. Now, there are different types of stress, basically 3 types of stress. I mean, stress that's neither good nor bad and is not a threat doesn't really arouse our brain much. We're kind of bored, but that's a state that we can be in. You have a boring summer job, you're bored. The next stress is called a good stress or inspiring stress. This type of stress motivates, such as it motivated me to make sure I got this presentation done. Didn't hurt me. Helped me get it done so that I was ready for today. So this good type of stress helps us improve our performance and our mental skills. It helps us be more alert and have a concentration to do what we need to do. Then there's the bad type of stress, distress. It can be acute with short duration, such as when my brain froze taking the test, or it can be chronic when it lingers for a long period of time. The chronic stress is really what's linked to the health risks. Chronic stress is associated with disease because the body is constantly aroused and set for danger. Stress management programs work by helping participants find their optimum level of stress level for you, and also help learn coping skills and relaxation techniques to utilize when you detect that your body's in stress. One example of conscious control is to use deep breathing to calm the system. Acute stress or short-term stress can actually be of value. It can help release cytokines. It's part of our defense system, consisting of our blood, our tissues, and our hormones that are promoted from the brain that facilitate the response. So T cells are like weapons that protect us, and I know all of you know more about T cells than I do. They're activated by a hormone called cytokine. So cytokines are signals or alarms that tell the body how much and what type of defense is needed. This would be like interleukin and interferon. And they play a role in the growth and development of cells that ramp up and ramp down the immune system. So short bouts of stress aren't really associated with a lot of the negative processes that are associated with chronic stress. So in the acute stress response, the body is alerted, the brain will determine there's threat, and then it activates the endocrine system, and then after it returns to normal. And this is normally in a response to releases adrenaline. So acute stress response is usually short. It's like 10 minutes. Adrenaline is a short-lived thing. Like I said, I have an adrenaline junkie son who really likes that, activity, racing, and get that heart going. But then it calms down again as soon as that activity is done. So your heart rate increases, your blood pressure increases, your ventilation, you're breathing hard, you have more blood flow, increased sugar, increased fatty acid mobilization, increased strength, and of course you're sweating to cool the body. So this type of acute stress can be activated with all sorts of stress, not just physical. It can be emotional, such as when you watch a horror movie and your heart is racing and the ghost pops up and you jump. Yeah, it's not a real threat, but it's activating that stress system. Now, signs of too much stress. Too much stress causes the release of cortisol, and most of you have probably heard of cortisol. It's what influences the body organ system in a much longer manner. It's what causes our heart to race and blood pressure to elevate. It is associated with wear on organ tissues and increased inflammation. So this type of stress is a concern, particularly for people with lupus that have organ-threatening disease. Chronic stress is an alarm reaction. The body tries to revert back to calmness by resisting the alarm. The perception of the threat still exists and it continues at this high metabolic rate in organ tissue such as the heart. So the organ tissues become exhausted. In a normal stress response, as I mentioned for adrenaline, the adrenaline is a quick response and then goes back down. Cortisol is more toxic to the tissue, is more difficult to regulate. The tissues can become sore, tired, sensitive, and fatigued. The brain can have difficulty with memory, sleep, concentration, and difficulty controlling blood pressure. The immune system can also be affected by changing levels of inflammation. Just like benefits to stress, there's also benefits to pain. Pain is designed to protect us if something's too hot, too cold, too sharp, too dull, and to also know how much pressure we need to move something. So all this receptor information is really helping protect our body so we don't hurt ourselves. Acute rapid onset of pain is relative to the biology function associated with tissue trauma. This has a protective function lasting seconds. So it warns us that an injury has occurred. And then it also triggers our inflammatory system if the tissue is damaged so that it produces the inflammation to immobilize us. So in this case, there's sensory receptors that detect the hot, cold, sharp, or dull that inform the brain and stimulate the spinal neurotransmitters to communicate with the brain sensor response. So I, again, take that hand off that hot burner. Or don't freeze. Okay, just like stress, there are many types of pain. Pain can be mediated by what's called peripheral pain. That means your distal extremities, your arms and your legs, your body pain. And nociceptive pain means danger pain, that tells us that we're in danger. And I'm sorry, this slide has a couple of spelling errors. I was going to tell Sandy to correct and I didn't get it done, so ignore that. But anyway, this acute pain is just short-lived pain. I've just talked about it. It can be because the tissues are damaged or your muscle is damaged. Another type of pain is inflammatory pain associated with too much swelling in an area. Pain can also be what's called neuropathic pain. Neuropathic pain is mediated by our nervous system. So in this case, it's neurotransmitters that create the sensory response. So when you think of the nervous system, actually the nerves are kind of like electrical cord, and they are very small and soft, so they're pretty easily damaged. So if you are just resting on your elbow and happen to rest on the inner side of your elbow, you may start to see that, oh, I'm getting pain, because nerves are very sensitive to pressure. That's protective so we don't damage ourselves. So this pain mechanism is designed to inform us when the nervous system is under too much pressure from swelling or from a crush, but it's a way of triggering the pain mechanism based on the nervous system feedback. And then the last type of pain is central pain. This is what we normally think of when we think of chronic pain. It's pain that persists longer than what we might normally expect. So in the case of the tissue and the muscle pain, we know that that pain usually is most severe when it first happens, and then as your tissue heals, they go away. The nervous pain, we have the pain, it signals our body to move or reduce the pressure, and then the pain goes away. Or maybe you have to have surgery for it to go away. But in central pain, that pain may, instead of decreasing after the injury, may actually increase and have lesser relation to the tissue damage or the nervous system damage. The brain itself starts to mediate the pain. We'll talk a little bit now, I have a few more minutes, about pain biology. So this gets into how it works to really understand our pain system. So some of this, if you look at this slide, you may like, oh my gosh, what's she going to be talking about now? But I'm going to try and make it simplistic. For our eyes have receptors that detect light our brain sees. For our ears have detectors for vibration, receptors for vibration, allows our brain to hear. In our tissues, we have receptors in our skin that detect different types of touch and different feelings, and that helps our brain interpret if this is a safe or not safe sensation, a pleasurable or unpleasurable sensation. So the brain actually interprets the message. I think of the nerve, there's a receptor and then there's a nerve. I think of the nerve is what communicates to your spinal cord, as an electrical cord. It's conducting electricity. They are receptors that's carrying the current to our brain so the brain can get the message. That message that our brain receives can be the sum of the input it receives. So if it receives a lot of input, it may say, yes, we need to activate. If it's not receiving a lot of input, the brain may say, no, that's okay. It's okay. It's not that bad. The amount of receptors that we have depends upon the area of the skin. So some areas of our body are designed to have more receptors, such as our hand and our face and our feet, so we can detect finer levels of touch. And there's an associated area in the brain then that interprets those messages. Although much more than just one area of the brain is involved in detecting these sensations. So there's also receptors that are located in and near joints that help us detect motion and where we are in space, even if our eyes are closed. So when we look at these receptors, you'll see I have listed A-alpha motor. That's a muscle that's a muscle receptor. And the 60 meters per second is how fast it's traveling. And you can tell these are very small fibers. That's what the micron is. Then for light touch, this could be if somebody just touches you very lightly, very light massage. This is A-beta fibers. They're also conducting pretty fast, 60 meters per second. They're also very small, and they can detect the difference between a light touch or a pressure. And then there's A-delta. A-delta is kind of your protective response that we normally associate with pain. This is detecting if something's too hot or too cold or sharp. It also is very fast, 20 meters per second, and is very small, 2 to 5 microns. Now, what's creating the difference in speed of these fibers is like how much insulation is around the nerve. We call it myelin, but you can think of an electric cord as has insulation around it to help that conduct. It's the same as our nervous system. But some fibers are what we call unmyelinated, so they're not very insulated. And because of that, they conduct slower. This is what we might call a C fiber. I'd take out the word again, pain fiber. It really isn't a pain fiber. It's a sensory fiber. The brain interprets pain. So just like if an electrical cord is crimped, if these neurons are crimped or something happens that reduces their ability to conduct, such as neuropathy or diabetic neuropathy, their ability to perform their function is reduced. So I have a couple questions, just I'm going to ask you and you can think about it. So this is true or false? There are no pain fibers in the body, true or false? It's true. There really isn't. There's nerve receptors. There's receptors and nerve fibers, and the brain interprets. It's really not pain fibers. And then when a body part is injured, there's special sensory receptors that convey messages to the brain through the nervous system. True or false? That's true. Now, I want to leave some time for questions, but I'm going to talk very briefly through a little bit of examples that also talk a little bit more about pain. And this would be examples of what kind of things that pain education would include. Pain education would talk about the nerves themselves and that there's a synapse that is pretty much ion-based. It functions on different chemicals that either activate or deactivate this system. This pain response also, as I've mentioned already, has been shown that there's a lot of inhibition that can occur even at the spinal cord level. Endorphins come to mind here too. Endorphins are an example of neurotransmitters that work to regulate pain, particularly to decrease pain. Like morphine, it's a chemical response to inhibit pain. So they cushion our body's ability to fight in pain by regulating the degree felt. Without those endorphins, our perception of pain would be constant and intense and would result in abnormal functioning. Now, with regards to pain neurophysiology, the brain and the nervous system are both plastic. And what we mean by that is they can change based on the input that we're putting in. So the concept of peripheral sensitization is if there's a lot of continued pain, the way that our body responds to that can become sensitized. So what we didn't feel as painful before may all of a sudden really become painful. So that can be change the way that way our body perceives that nerve input. Another way that our system can be changed is through what we call central sensitization, which is in response to how the brain is regulating through hormones this input. And it can become sensitized too, sending more of these hormones that are creating the pain response. And this is really what happens in chronic pain, is that our system changes. And rather than having pain become related to an injury, it just self-mediates. Now, the nice thing is that because the brain is plastic, we can influence that system to return back to its normal state. But it's not easy. That's not an easy thing. But that's basically what pain management, chronic pain management programs do, is they try and give more normal input into the system to get it to be more of an alarm response again and not self-mediating. So I have a couple of true-false questions for you with regards to this. Worse injuries always result in worse pain, true or false? Not necessarily. And I know that other therapists, a lot of times you may think that's true, but when we're working in the clinic, you can have a very small injury, such as a little fingertip, which there is a lot of receptors in the fingertip, so I don't mean to pick on that, but that really creates a lot of dysfunction and pain, loss of sleep. So there's other influences that it's not just the pain alone that influences our reception. It's also emotional responses and many other types of things that are influencing it, not just the level of injury. So in contrast to that fingertip injury, I might have somebody who has an arm replant, and they're like own their own business and they're going back to work. I mean, it's just amazing. So the extent of pain isn't always correlated directly with the extent of the injury.
Brenda, Brenda, I'm
Yep.
going to interrupt. I want you to know you have 10 minutes left.
Yep, and I'm in a good spot, so
Excellent.
that's great. So um, basically, stress can aggravate pain. Pain can aggravate stress. Go ahead and do a slide forward. Now, I've pretty much glossed over this whole pain regulation system, but I put this slide in because it gives an example of how complex it is, showing that interaction between all the chemicals that our brain is producing and sending to our system to regulate our response, and that it's not only the receptors but the spinal cord and the brain that all contribute to our perceptions of pain. Now, stress and pain management programming are based on the premise that cognitive thought influences brain's perception of stress and pain. Stress and pain management programs fall pretty much along a wellness paradigm that promotes physical well-being, emotional well-being, intellectual well-being, and spiritual well-being. So the focus of stress and pain management programming is to empower a person through understanding their own system, to learning about how their body responds, learning when and what type of intervention might be best for them, because it can be very individual. Something that works for one system may not work for another. One person may find that journaling is a very helpful experience for them. Other people might find that that is not the way, and that there's another type of a management strategy that might work better for them. So this brings me to a program that's going to be offered this coming fall by the Lupus Foundation, that is put on by St. Catherine University, our Occupational Therapy Department, and our occupational therapy students that are in a capstone course called Master's Project. And this program is going to focus on stress and pain management strategies. It's going to be an online program similar to this. It's going to be educationally based. It's going to have ideally up to 6 to 8, or probably 6 people, 4 to 6 people in 2 different groups. It'll be offered Thursday evenings from 6 to 8 or Friday afternoons from 1 till 3. And the dates are October 15th through October 19th approximately. And this program will kind of follow up on the topics that I was talking about today. It's kind of the third in an educational series that I've been working with the Lupus Foundation. Our first series was fatigue management program. Our second series was a physical activity program. And now this third series is the stress and pain management program. And the development of these programs are directly in response to the needs that I found that the Lupus Foundation members indicated that they had, that they were interested in.
Brenda, I think we have time for a couple questions, or at least one.
Yes.
So one of the questions that a participant had asked is, do you have any ideas about the impact that medication might have on stress and pain process?
Yeah, I think that's a very good question. As occupational therapists, we do not give medications out like a physician would, so we're really not trained to really fully understand the effects of medicine. That said, there definitely is interplay, especially if the medication is dealing with hormonal responses. So I think it depends on the medication. I mean, like, we know aspirin reduces pain, so there, definitely there can be interplay. How much interaction there is dependent upon the particular medication. There's certainly a lot of them. I think of Neurontin, that's working on the nervous system component of it. So it depends on what area of the system that medication is meant to work on. I mean, there's some of them that are geared towards our thought processes. So there's a lot of different types of medications that definitely can affect your perceptions of of pain. Depends on what part of the system they're trying to affect.
It sounds like that might be a very good question for people to bring into their rheumatology appointments.
Yes, I think that is, and it's very complex. And keep in mind, I just said it's very individual as well. So this is why a lot of times they're juggling between one medication or another, and this one works for one person and this one works for another, because there is that individual difference in our
Yes,
anatomy and the way that we respond to treatments.
thank you. We have we have time for one more question. What activities might people avoid during times of high stress and pain? So the stress and pain aren't exacerbated. Any thoughts?
Um, I think again that's individual, but I want to speak to it a little bit. I mean, I think there's quite a bit of evidence that our society in general is more stressed today than it used to be. And I think about reducing ways that stress is feeding me. I mean, I think of things like, the cell phone and constantly having that information bombard us. That is one thing that can sometimes feed stress. I think it depends on your own life. You really have to look at your own lifestyle, which is what stress management program does. Looks at your own influences and looks at what things you control and, how can you take that back. Like, for instance, for me, I know that if I hear a lot of upsetting news, it doesn't help me. So sometimes I drive with the radio off. I mean, take down some of that input that your brain is receiving. That would be, I don't know if that directly answers the
I,
question.
I'm sure it does. Thank you very much. And unfortunately, we need to wind down. So this concludes today's webinar. Thank you, Brenda, so much for the presentation. We appreciate your expertise in this area and the information that you've given us. As you suggested, the more knowledge we have, the more increase of understanding we have, which really impacts positive healing. So I think you've left us with some good information that has increased our knowledge. And I want to thank everyone who's joined us today for this webinar. Please, again, look for the evaluation that will come via your email, and we hope you get on our website and know that people living with lupus and other chronic conditions are always welcome. Thank you so much. This concludes the webinar.
Thank you, Sandy.
Yes.